Hello, I'm Dr. Gary Meek from 180 Health Medical and Wellness Center. And a little bit about why we started our office is we were looking for natural options for treatment of things like arthritis, especially joint issues like shoulder, knee, hip, back, neck, things like that. I've been doing this for, going on 28 years. And one of the things that's been difficult with treating these types of conditions as they start advancing is that I'd see a patient, we'd treat them but get some results, but not really what a patient wanted. And one of the things about why we started this office is that it gives us an option to treat arthritis and osteoarthritis for different joint problems. And a problem we see is I would refer a patient out to see an orthopedic surgeon, and they'd go in and they'd come back and say, well, they told me there wasn't really anything they could do for me now, but come back in 5 or 10 years and you'll be a surgical case then. So what we were looking at is trying to give a treatment option for people that's non-surgical, drug-free, that gives them that ability to avoid drugs and surgery, and ultimately that's what we're about. And so if we start looking at osteoarthritis, arthritis is the #1 cause of disability for people over 50. And so this is a big problem we see in our patients over 50 years old. Another thing we were looking at is the opioid crisis. And a lot of patients have been coming in taking opioid type drugs, and when you look at it from a standpoint of addiction, which is a big problem, 1 of every 4 people that get prescribed an opioid in a primary care setting ends up with addiction issues. And so really trying to avoid that. So avoiding the addiction issues and problems that come along with medications, and also all the problems that can happen with side effects or risk of having surgery. Those are the things we're trying to avoid. And so, other things we're looking at is from a functional medicine point, trying to teach people or get people on a path to get healthy. And that's one big problem we see in all of healthcare is a lot of people will come in taking 10, 15, 20 different medications, but the medications don't make them healthy. So a goal with that is to get them doing nutrition and diet and exercise. If we start looking at people with type 2 diabetes, if they're taking medication to control their diabetes, but they're not doing anything lifestyle-wise to reverse their diabetes, then that's going to be a long-term problem. It tends to lead to the heart disease and the cancer and all the other chronic diseases that create about 75 to 80% of our healthcare costs in the United States. I think one thing, a big problem in the way we go about healthcare in the United States is we don't really get people healthy. And if we keep treating people with drugs, all we're going to do basically is manage their symptoms and keep them, sick. Long term, they're going to be sick. People that walks in our door with taking 10 medications, if they don't do something to really reverse everything, they're going to spend the last 10 to 20, maybe 30 years of their life being miserable because they're just managing a bunch of symptoms. They never get healthy. So a big goal is going to be people getting the lifestyle things they need to do to become healthy. So our goal is to turn your health 180 degrees in the right direction. And so we look at a whole body approach for that so that we can make you healthy again and get your life back.